Welcome back to our quality improvement webinars for the Parenting at Mealtime and Playtime Quality Improvement Project. This webinar is entitled Process Literacy, and it's going to help you with the process office flow mapping process and how you can go about outlining what different items you'll be integrating into your daily clinical flow with respect to the Parenting at Mealtime and Playtime program. Edward Deming, one of the founders of quality improvement work, said, if you can't describe work as a process, you can't improve it. So what we're going to be working on today is defining all the components of our office flow as a process so that we can work to embed different items and improve them. There are a couple things that we'll be covering. We'll look at process and flow concepts and the different process and office flow mapping strategies that can be used and the ones that we suggest that you use for this project, and figure out how those fit in with respect to your team roles, aligning this with the project and practice aims. Measurement and evaluation, as that's a key thing to have layered in here throughout this initiative and as you move from testing and implementation onto sustainability. And then identifying areas for improvement as a whole, and then for you to think about that and reflect as practice-specific areas for improvement. So processes were developed for a reason. They help us become more efficient. We can feed back information from patients into the process so that we can make it more patient-centered and have it as a convenience. We know what we're doing, how we're going to do it, who's responsible for what, and it works for us. And then we also have processes in place based on our organization or institute that we're with so that we're compliant with rules and regulations, especially as we get into healthcare. We have certain rules and regulations that we need to maintain. But given the intricate nature of healthcare, it's difficult to really fully experience and understand a process from everyone's different vantage points. So what we want to do is make sure that we fully understand a process and that we don't become process illiterate, so that we aren't really familiar with what is actually happening day to day, especially from that patient's point of view, and that we also don't become arrogant, that we have this overwhelming, exaggerated sense of knowing how things work when we're really too far back from it and removed that we don't really understand what happens. Both of these items can develop over time as we get stuck in our routines, which happens all the time. So here it's just taking a moment to reflect on what we do, walking the patient's shoes from start to finish, and then figuring out how we can layer in some new components with respect to PMP. We're going to analyze our process. We want to have a common picture, a shared type of model or vision for our quality improvement teams within your practice, because team members experience processes differently. The person at the front desk may not see what happens as you're triaging and taking the patient in for their different anthropometric measurements versus what the nursing does and the provider does. So just making sure that everyone is aware and has a good general picture of what is happening, and that we can really center it around what the patient experiences, what paperwork they have to complete, conversations that they have, and use that to hone our improvement efforts. We can also use this to understand our organization and clinical settings culture and the context within which this process is occurring, and really help everyone to own this process. We want this to be a team building activity, and staff are involved from all different components, from the review and the design of the process improvement, so that they're not just investing time to PMP as a quality improvement initiative, but making this a sense of culture and context within your clinical setting. And then we have the culture, as I've mentioned, in understanding our organization's culture and context. Our culture is really that pattern of learned group-related perceptions. They could be verbal or nonverbal, that has added to the values, the belief and disbelief system of those involved. And it's really the set of forces that help the individual and collective behavior determine performance. And it's very stable within the organization. So we want to make PMP a stable part of your process. The context are the specific circumstances in which this event or situation happens, and it kind of is woven together with culture. So we want to identify the parts of system that are important to the different measures in order to understand and improve this care and clinical flow. And then we can identify and prioritize what components we need to target and think about areas that we think or hypothesize can be opportunities for change. And then this helps us tie back to that common picture of having a common model that helps us generate potential approaches to improving our system to reduce any redundancies or identify redundancies within the system, remove waste, places that we can reorganize our efforts, and utilize the changed concepts for our improvement efforts. There are a variety of different mechanisms that you can go about mapping out processes, how things affect each other. The one on the screen right now is a cause and effect diagram, and it helps you describe a range of factors that really influence the outcome or a problem that you may have identified. So you're starting with the issue or the problem that you would like to be solved, and then you build back out to look for 6 specific areas of people, processes, policies, methods, materials, and environmental factors that may have influenced the problem or issue at hand in some capacity. And then from each of those 6 kind of bones that are coming out from this fish or the cause and effect diagram, you're going to investigate or think of different items within those 6 topics that could be leading to an impact on that cause. And then we can investigate each of those areas and see what type of weight it carries to the problem at hand. This one is really used when you have some sort of issue that you need to troubleshoot within your overall clinical flow, and maybe something that you come back to at a later time. We will be using other office flow type methods to work through the initial process mapping from start to finish of a patient experience within your office. So we'll go through how we can model what the process looks like. And that's really just putting the process and the different steps and decisions that there are onto paper in some sort of format so you can walk through from start to finish about what's happening. Flowcharts really use standardized symbols with some notation to denote the patient's path through the system. We have deployment flowcharts, which are a step above that, using very similar symbols as a normal flowchart, but you have different swim lanes or columns for each person's role and responsibilities within the process. And then you can also have some columns for measurement and change opportunities. And then the final option that you could use as a workflow diagram, and this really looks more at the physical map or layout, or if you did like a room diagram of the office setting to show how people actually move throughout your building or throughout the rooms within the office. And it can also be people and information that move through the process. So there are 3 different ways that we can approach what happens in our clinical setting, and we'll be using a mix of the first 2, flowcharts and deployment flowcharts. A flowchart is really just a snapshot or a visual cue of what happens with respect to a process of interest. It looks at specific steps and the details that occur in each of those steps, as well as decisions that are made from the start to the end or when the process completes. This is just a really streamlined way of looking at what happens, and we'll go through the different elements that it typically includes. Flowcharts are just a really easy way to diagram out the steps or stages of a process in a sequential manner. And the amount of information that you put in this diagram really depends on how you want to use the flowchart. So if it's a more high-level bird's eye overview, you may just note that Y comes after X and the steps that occur to get there. If you're going to use it, if you have a lot of turnover in staff, or if it's a part of training that you would like to focus on, then you may layer in some additional information. And it's also something that can be a working and living document, so you may add detail to it as you progress through, update it as needed, and work from a testing phase, which we'll be doing through the course of this quality improvement project, to more sustainable phase where things will be highlighted and documented maybe in a different fashion. We have symbols that represent each step, and there may be a couple words jotted down in each of those symbols to denote what happened in that specific step or decision that has been made. And then we link everything together with arrows to help indicate the flow or direction that we'll be moving throughout this process. We really start by identifying what it looks like in its current state. So the work that we're going to be talking about now and in some of the future slides and even webinars, we'll be looking at a process that was mapped out basically prior to coming to PMP. What did your office flow look like from start to finish as the patient walked into your door, had a series of interactions or paperwork to complete, had the office encounter, and left your practice? We want to look at what it currently looks like so that we can work to improve upon that, make it more efficient, layer in PMP specific elements, and update the process. Once you've identified the process that we're going to be looking at, recruit some individuals, hopefully those from your core quality improvement team and other key players that you think may be involved or interact with the patient throughout their time in this process. It's also helpful to involve that leadership, just like we spoke about with the core quality improvement team, talking about this project with your leadership. Having them involved in the office flow and process mapping may be helpful, even if it's just at an overview or review of what the process actually looks like. We're going to start by drafting it at a very high level, the basic elements that are included in here. And then, as I mentioned on the previous slide, you'll layer in the detail that you need as you feel that you fine-tuned how you're going to actually use this document. As always, keep the patient perspective in mind. So you may be going through this at the first go as what you as providers see, but then walk through it thinking about what the patient sees, what they have in hand, what they may be dealing with, so that you can make sure that it is adapted to what they'll experience throughout the process. Then you're going to start out by identifying what's that first step, or the beginning, the input, with what the end or output is. And you'll work to tie those two together with all the different steps that occur between. And you'll walk through the process by asking, what's next? So starting at your input, this happens, what happens next? And do that continuously until you get to the output. And again, highlighting just here that we're looking at the current state, and we'll work to move towards a more final state as we get a little closer towards the end and think about our sustainability plan. There may be points in the process where you have to make a decision. These are represented by a different symbol. You can list out all the different options or answers or choices that you may have as you make that decision, and then ultimately all those different options pathways will come back into the main process. So you may have a bunch of different ways that you can go as a decision tree, but ultimately everything comes back in at one point or another so that everyone ends at the final same step. And you'll repeat the last step of making decisions and asking what's next until you reach the output. The final step is to go through and actually observe this. So every player's come to the table, discuss what their role may be, how they interact with the patient. Now actually walk through that to see if anything was missed. And then you can see if there are other extra steps that people are doing that weren't indicated on the paper, or if things were left out. So you get a balance of both anything that's missing or extra elements that people have added to the flow as they're part of daily working role and responsibility. And then we can work to fine-tune this process. Now here we have the nitty-gritty details. And the important part of this exercise and the office flow mapping process is not to note whether you've used the right symbol for when you make a decision or have a connector. We really just want to make sure that you are outlining all the different steps of the process and decisions that need to be made, whether this is a future training tool or the map is to really just understand the process. But we want to make sure that you get everything down on the paper. And then if you have the right symbols, that's great. And it helps with a better quick orientation and visibility cue about what's happening. So on this slide here, we have several symbols that are most commonly used. The oval at the top is that indicator for that input and output, the start and the end of the process. So this, of course, will be used just twice. The one that you'll use most frequently is the action or process step, that rectangle. And this is a symbol step of the process that you make a quick note. If you're printing any documents or giving PMP handouts, or the parents have to complete a questionnaire or indicator questions, you can use the document symbol. So it's replacing the bottom portion of the rectangle with a wavy line. Decisions are probably the next most frequent thing that you'll be using, that diamond, and you'll note the different points or options that come from that decision to ultimately come back into a step of the process. And then the connector, if this is a really long process for you, will be indicated by a small circle. So you'll note A to connect page 1 to page 2, B for 2 to 3, and so on and so forth, depending on how many pages you have. And then again, you'll connect everything with the arrow to note the sequence of steps and the direction of flow throughout this process. The first step of mapping out any opportunities for change, reducing inefficiencies like things that may be redundant within your system, and standardizing processes for your daily clinical workflow is to map out what your process currently looks like and what it does for patients from the time they walk in the door until they leave your office. So the example we'll be walking through does just that and is from a past participant in this quality improvement project. You can do how it looks on the screen within Word or PowerPoint. You can even write this on paper. Again, we said the symbols are not the key point here. It's noting out the steps. And some people actually just bring out a big piece of white craft paper and use Post-it notes so they can move things around and make sure that they get all the steps in the orders that they occur in the most editing way that's easy. And then you can make it more fancy and formal in a Word or PowerPoint document if that's the direction you would like to go. So here we look at the patient checking in at the front desk. That's our input. And then we see several rectangles here denoting steps of the process. The patient leaves the waiting room with the nurse. We have a decision to make. Is this child older than the age of 2? If not, they go to the exam room. If they are, then they go to the scale and stadiometer to get their height and weight measured. From there, we calculate percentiles, and you can see how those two different decisions from age older than 2 come back into the step of going to the exam room. And then we have the connector A. So we can see that this process is longer than what's indicated on the slide, and we can move on to the next step by going to the page with A as its indication. So from here, they page the physician who collects and reviews the HPI, review of systems, a diet and activity history, to go on to examine the patients, discuss bright futures. The MD orders immunization and referrals, looks at the schedule of the next visit, and then the final step noted by that oval is the output and the patient leaving the office. With that current process in mind, they've had people walk through it. All different points of contact were indicated on there so we know what things look like. It's helpful to come back now to the key driver diagram so we can orientate ourselves to what the project aims are and then review any proposed interventions to identify how your current process differs from some of the best practices and evidence-based elements that we have for PMP. And those best practices and evidence-based elements will be potential ideas or tests of change for your plan, do, study, act cycles that will help facilitate testing and eventually implementation of particular process steps within your workflow. So here you can look at the aims of how we're documenting obesity-related health risk, having anticipatory guidance provided, and use of our goal setting and working with any patients that have identified overweight or obesity to set a goal with them and the proper interventions that we can use to impact those. The chart review tool is also another element that you can visit to help highlight where there may be some opportunities for improvement as well. So you can tease out the different components of our specific aims by looking at the stepwise chart review components that you'll be going through and how that figures within your office flow. And in addition to that, building in processes for reviewing and looking back at a prior visit. So those questions on setting a goal and following up on opportunities for change are embedded here and something that you can work to identify within your office flow, how those might best fit. Tying in with the key driver diagram and the chart review tool are the physical items that will assist in making some conversations more concrete. So PMP Resources, we have a wealth of those resources to equip you with as you go through the trainings and download the handouts from our website. And I have some of those displayed on the screen here. So indicator questions are represented by the two forms here. We have two sets of them, birth through 24 months and then 25 months to 5 years. The three questions that are unique to PMP that you can ask of families. You can have these forms printed out and in the waiting room. You can put them in the exam rooms. Nursing staff can go through and ask questions of families. Families can complete them on their own. Whatever route you decide to take, that information will be documented within your medical record and reviewed in the chart review process. Then we have the actual handouts that accompany each of the specific well-child visit age groups. Here on the screen is an example of the 12 to 24 month well-child visit handout that you can hand out to families after you've gone through some of the anticipatory guidance that you may offer around nutrition and activity. And then if you're looking to set a goal or you've identified an opportunity for improvement or change, here's a goal setting sheet. This is the front of it, and it looks at, after you've had the conversation, gauging how important the specific change is for the family right now and how confident they feel that they can make this change. And the back of the sheet helps you work through the different elements of setting a goal. What is this goal that you're working on? How often will this actually happen for the patient? Who will be working on the goal with that child? And when would they like to reach this goal by? So it really helps walk through some of those SMART elements, the specific, measurable, action-oriented, relevant, and timely features of a SMART goal in a more succinct and patient-friendly fashion that walks through the elements that they'll be working on and then what you can note within your chart to review. And yes, we have some more symbols. The main one I wanted to focus on here is the cloud, and it's on that top right column, and it's when we don't really know what happens here or there's something that we would like to test and investigate further. That's when we can use this symbol here and just place it in our process for, we're going to come back to this later, look into it a little further, and decide what action or next steps need to be taken. This slide now incorporates some of the cloud symbols that I mentioned on the previous slide. We have several opportunities in our current office flow map that we can figure out how, when, who may be the best person, place, or way to incorporate some of PMP's best practices. The first cloud that we have is our habits assessment, and how can we use the EMR dot or SMART phrases that you've embedded at the initial meeting best. So you can think about this, have a conversation with your core quality improvement team, with the practice coach, with myself, to troubleshoot, problem solve, and come together to develop an idea for a test of change around this item. Another option may be, when you looked at the chart review tool, categorizing for 3-year-old and older the blood pressure status. So you may be measuring this, but you may not be categorizing it as a normal, an elevated, or stage 1 or 2 hypertensive status for that child, and therefore documenting it. So as you are taking the height and weight, how can you incorporate blood pressure? And then as the nurse moves on to that next step of the process of calculating percentiles, let's figure out how we can incorporate that categorization of blood pressure as well. There are other opportunities for change. The changes that you select to work on are dependent on where your practice's baseline lies with respect to the interventions we have listed in the PMP key driver diagram and as you reviewed the chart review tool. So you may have some processes or steps of this already started and building upon those. Or you may not have some of these elements and you need to start and build a proper foundation. One of those may be reviewing the family responses. So you'll be collecting and looking at some key PMP habits of families. Who will provide those questions or ask those questions to the family? How will you collect that information and document it within your EMR SMART or DOT phrases? And how will you look back at that? Then there's doing the comprehensive PMP specific risk assessment around weight status, growth trajectory, the blood pressure categorization, family history that's centered on obesity-centric risk, and then the PMP counseling. How can you layer on to what you're already doing within all of these areas to get up to where PMP is asking you to be? PMP well visit handouts. I discussed those several slides back and showed an example of one from the 12 to 24 month well child visit age group. There are other ones that you can certainly hand out. At what point in the process is it good to do this? Have the nurse provide it when they're rooming the patient, as the physician is discussing bright futures and PMP anticipatory guidance, when you give the after visit summary, front desk. There are so many ways that you can do all these different clouds. That's why they're listed here, and you can figure out what works best within your specific clinical flow, the people that work there, how your patients normally receive handouts, just food for thought and potential ideas that you can work on. And then finally, use of your motivational interviewing skill set. That's nothing that you really need to have documented. You may want to call it out here as a specific step that you hone those skills, that you may come up with a quote unquote elevator speech that you can go through certain steps to work on behaviors with families. And then looking at goal setting and follow-up. Specifically, the child's prior visit, checking to see if they had set a goal at that visit and following up on it at the current visit. So you're sending them away with a goal, but are you actually following up on goals that had been set? And then on the other half of that, you've done your PMP risk assessment. You may be giving out handouts and using motivational interviewing skills. How can you combine all those elements to have the family walk away with a bite-sized yet achievable and stretchable goal, and documenting what that goal was within your chart? So that looked at a current office flow with some potential ideas of change or PDSA cycles layered upon it. This slide now depicts the deployment swim lane example, and this is one of my favorite ones. I think in addition to the visual that the normal office flow map provides, this quickly highlights, and you can certainly color code it and compile it in different ways, but highlights in columns who is responsible for what step in the process. So across the top of this, you can see front desk, the patient and family, nursing staff, and the physician. And underneath that, what parts of the process they interact with the patient, what duties they may be performing. And it's just a quick way of seeing here, most of the work that we're seeing for this first half of the process is with the patient and the nursing staff. And then you can see some of those changes that you've suggested, who that really impacts, and how you may need to update your flow around that. So again, the habits assessment, those questions that you'll be asking of them and how you'll embed those into your EMR. Is that something for the front desk? Is that something that impacts the patient and family? Yes, you're asking them questions. And is the nursing staff or the physician going to take on this role? Where does this cloud actually fall, and how will that affect the process? Measuring and categorizing and then documenting the blood pressure status for those 3 years and older. That may fall in the nursing staff, as we see that they're currently doing height and weight and calculating percentiles. It might be a good place to embed that. When we layer on these clouds and potential ideas of where and how and who will implement a change, There are the possible changes, and those are listed on the left-hand side. And then we want to have some way to capture or measure that this change is having the desired impact. It may be impacting things, but is it impacting it to the degree that we would hope? So on the left-hand side, we see possible changes that we could do around each of those clouds that we had listed that we weren't quite sure how to attack. So looking at the habits assessment and EMR phrase, distributing the questions while the family is in the waiting room. That might be one way that we trial things in a PDSA cycle. And a way to measure that would be the percent of families from a specific age range, let's say newborn to 24 months, who actually receive the questions. So keeping a quick tally of this will inform you within one clinic's afternoon how well this specific change around that cloudy area has worked or not worked and how it's impacted flow. And you can build upon those lessons. Similarly, for those possible changes, these are specific to the blood pressure measure of adding potentially a blood pressure reading, especially for those kiddos that are 3 years of age. You may be doing it for the older kiddos, but getting that into practice and evaluating the percent of 3-year-olds that are having a blood pressure taken. If you need to average or retake that, that might be a step up once you finally do the blood pressure reading with the younger population, making sure that you're having an accurate one. And then documentation of that blood pressure category, or here we're also looking at weight status, and this ties in nicely with our measures that we have for PMP. So if you do make this change of I'm working to document blood pressure and or weight status categories, we have that reflected in our run charts to let you know how that specific change impacted your data. So it's one less step for you to have to collect and evaluate, but you can have some short-term feedback in the meantime from those PDSA cycles. So a brief summary, we really hope that this is something that you can do with your team and help it to encourage that team communication and collaboration. This is a time for you to come together and, if you haven't already, identify roles of each of your team members and create that environment for teamwork and then help you be efficient. You'll have briefs and debriefs, maybe at the start and end of each clinic or around this exercise. Make sure that when you're communicating, it's happening with all the players that are involved in this, and having some way of passing that information on, be it meetings or emails that go out to the people that are involved in this, and making sure that you have total team buy-in at all steps of the process. You guys have walked through and created this process map. Hopefully everyone has gone through and viewed it and given their feedback on it, how it may affect them, and helping it shape the culture that this is now something we're doing around improving the health of birth through 5-year-olds' diet and activity. Try and think about this through the lens of sustainability. So that may be in the back of your mind. Getting this to be something permanent may be the last thing that you're thinking about, but you also want to develop systems that you know you can keep going. So while this is a quality improvement collaborative and initiative, we're working to help you reach measurable outcomes and aims. Those are like the high gold standard, but doing that in the long term may not be something that you can sustain. So while you're doing this and getting to that gold standard, work to design this process to account for how you guys behave in your office flow. What are things that you commonly do? How can you maintain this? And if you know that there are certain ways that people make mistakes, have the system prevent those. How can you keep that from happening? Be it flags in the medical record from the front staff that may assist in this, Post-its on the door, boxes to collect things, quick visual cues and reminders that can help the system support human behavior and prevent error. Help things be organized. And then, as we mentioned in some of the webinars prior, empowering and engaging your staff. You're not in this alone, and this is something that you want to take on as a team. So having them have a voice and engaging everyone. And then target your improvement efforts. You know what your current process map and state looks like. Let's identify areas of waste They may be problem areas, you may be duplicating things, 2 or 3 people may be working on the same area. Let's fine tune what we're currently doing and then step it up and make improvements. And then get an evaluation plan in order. Think about small changes that you can make, how you can build upon those, and how you can move the needle stepwise in bite-sized pieces and changes to get to where you would like to be as a practice and to reach the PMP goals. So your next team meeting or action item, if you're doing this alone, is to make a swim lane flowchart. Look at the current process, not what you hope it to be, but what it currently looks like for those birth to 5-year-old well child visits within your practice, your institution, your clinic, from the first time that you have point of contact with them until they leave the office through those doors. Think about the different staff that are involved, their roles when they interact with the patients, from giving them paperwork to taking blood pressures to documenting things to giving after visit summaries or handouts, all those different steps, having them captured. Think about the different items that families have to do. We are asking them new questions. How does that impact what they may be doing for other components of their well child visits, or what they need to have the child do in terms of sitting and being calm for a blood pressure reading? Think about what the family has to do and how we can minimize the burden on the family as well as you, and all the different interaction and touch points of that family and the staff. I want you to then hang on to this document. It's a living document that we'll use throughout the rest of this initiative and update it with the test of change and plan, do, study, act cycles that you work on, and revise it as we come back and learn from different things over the coming modules.